Hey everyone. So I'm just gonna make a quick vlog about the Lupus annual general meeting that I went to. So it was really great. I thought it was gonna be a really long day because you had to be there just before 9 a.m. and the meeting itself went till 3:45. Um, and so the meeting itself went to 3:45, and then there was a volunteer appreciation dinner that was from, I think it started at 5:30, and we weren't really sure how long it was going to go for. So I was like, oh my gosh, this is going to be a long day of mostly sitting. But the day actually went by really quickly because it was so great. It was so interesting and inspiring. And I can't even, I mean, I totally forgot to film anything. And I can't really tell you every single thing that I heard because, I mean, it was so much to remember. But I'll kind of generally give you the highlights. So they had a raffle that you could buy tickets for, and of course all the money went to Lupus. So between my mother and I, we bought a total of 4 raffle tickets, and we put all of our tickets in a box to win this beautiful butterfly necklace, but we didn't win. But that's okay. Uh, so, uh, so, basically, like, there, I forget who she is now, but there was a lady named Julia. I think she was the president, of Lupus, Ontario. I think. Bad memory. Anyways, she kind of did like an opening, welcoming comment. She's, had lupus for years. And then there was a rheumatologist who was from the Toronto Western Hospital, from the Lupus Clinic. And her name was Amanda Steinman. And she talked about the roles of antibodies. She talked about the role of antibodies, antibodies in lupus. And so she talked about that, and it was actually like really interesting, and she explained things like so well that you could really understand everything. And they were generally talking about there's a group of lupus patients, and they're a really rare type of lupus patient where they either have like a really bad flare right at the beginning of being diagnosed, and then never have anything. They go into remission and never have another lupus flare again. Or they would have like a lupus flare, go into remission for years, and if they do flare again, it's like a very mild flare that they're able to get under control quickly, and then they go into like long bouts of remission each time, like years of remission. And they said that this is like a really rare bunch of lupus patients. It's a very small group. They have a specific name for them, and I can't remember what the full name was, but if you put it into like the first letter of each term, like the short form spells SAC, which is kind of funny. Like it's SACQ, I think. And so they call them SAC, and basically they're really trying to research these lupus patients because they want to know what it is that's what it is in them, whether it be genetics or DNA or something that's making it such a mild case of lupus, and they really want to study them because they want to try and figure out if there's something in them that can be applied to regular lupus patients like us that get flares a lot. So that was really interesting, and I know she went into a lot of other stuff in it as well, but I just can't remember everything. But what I really liked that she said was that at the lupus clinic, the doctors there do not go solely based on blood work alone. Like if a patient is not feeling well and they're having symptoms, even if their blood work is showing everything's normal, they listen to the patients and their symptoms and what they're experiencing, because they know that with lupus, blood work isn't everything. And so they actually even said that they don't routinely check your ANA because they know that the ANA often doesn't really mean much. It's more based on what the patient's feeling. And I really like that because for months now, my doctors keep saying, wow, your blood work looks great. Everything's going great. You're, into a nice remission. And I'm thinking, wait a minute. I don't believe I'm in a remission because I feel like crap. So, sure, my joints have been, pretty under control, but fatigue and the headaches and the nausea sometimes still, and just all these things, it's like, no, sorry, I don't feel like I'm in a remission. So, I was really impressed by that. Then there was another doctor, and I forget his name, but he was an ophthalmologist, and he was also from Toronto Western, and he was talking about the effects of Plaquenil on the eyes. And of course, basically he said it's a very small chance that Plaquenil will affect your eyes as long as you're on the correct dosage. And this was something that I didn't know. Apparently, you're supposed to be dosed according to your height. So if you're under 5, I think he said if you're under 5'6", you should not be taking, I think he said if you're under 5'6" and you're taking 2 Plaquenils a day, meaning a total of 400 milligrams a day, then you're kind of at the highest dosage you should be. So if you're under 5'6" and you're taking 2 Plaquenils a day, then you really do need to monitor your eyes closely or try to get the dosage lower. And so that was new information to me, and that was really interesting. And he went into a lot of great detail about the types of eye tests you should be getting and how often you should be getting them. And so I had a notepad and I took some notes on that. And then the last doctor that spoke was another rheumatologist, and he's the main rheumatologist at the lupus clinic, and his name is Dr. Urowitz, and he was amazing. He was talking about the current treatments for lupus as well as Benlysta, and also about some drugs that are currently in trials or currently almost in trials that sound really, really promising, that he believes will be out and in use in just a few years. So that was really hopeful information, and he explained lupus so well in ways that you could understand, and I was just really impressed with him. And after each doctor spoke, there was a question and answer period, so you could ask the doctors questions. It was just so informative, and I learned so much. My mother came with me. Alex was supposed to come, but he had to work. I was kind of disappointed on that. I think he could have gone on the Sunday instead of the Saturday to work. It was kind of disappointing that he didn't come, but my mother came with me, and just a wealth of information. And I was so impressed that I found out that the lupus clinic is taking new patients at the moment. So yesterday I went to see my family doctor, and I got a referral to the lupus clinic. I've heard it's about probably a 3 to 4 month wait to get in, but at least I've got the ball rolling, and I feel like I will be in the best care possible to get into this lupus clinic. So I'm really, excited about it. And the way that Dr. Urowitz talked about Benlysta, it sounded so promising and so good. And, he said at first when it came out, they were only really using it on, mild to moderate lupus, which I think most people have heard. But he said that they will probably be trying it as well on severe lupus, because he really feels that it's a good treatment. And so when I get to the lupus clinic, I'm really going to look into Benlysta, because I've heard so many good things about it helping fatigue and joint pain, which are my two main issues. And I mean, it's an expensive drug, but apparently most drug companies now will cover it. And there's also a program available to help with the cost. So, hopefully between the two, using the two, we would get good coverage. And I mean, it sounds like a great treatment option. So it really just gave me hope. And it was great talking to all kinds of other lupus patients there about what they've experienced, and a lot of them have seen Dr. Urowitz or attend the lupus clinic, and they told me such wonderful things about it. And actually, Dr. Urowitz was one of the ones that worked on coming up with the drug Benlysta. So he's really, really invested in lupus, and it was great. And then after the meeting was done, there was some rooms rented out in the penthouse that you could go up and hang out with other lupus patients, but my mom and I decided to just hang out in the hotel and catch up because we hadn't seen each other in a while. And then Alex joined us for the volunteer dinner. And the dinner was, great. We got lunch as well, like a buffet lunch, and there was a buffet breakfast, and there was a buffet dinner, all included. And the volunteer dinner was great. And my current leader of the support group I attend has stepped down, and she's now the oh my gosh, I forget now what she's going to be doing, but she's going to be helping something with Lupus Ontario. And so one of my other fellow support group members has now taken over as running our group. And I'm just watching my time here because I only got 15 minutes. And so the dinner was great, and there was a woman who's had lupus for, since the 70s, and she helped develop the Lupus Ontario, and she helped, with the clinic and get the lupus clinic going between her and Dr. Urowitz, and they honored her with an award because she's done so much, and she's gone through so much with the lupus. And when she was first diagnosed, like they said, she would only live a few years, and she's in her 70s now. And it was just really an inspiring day. Gave me a lot of options to look into, a lot of stuff, new information to learn, and knowledge is power, I say. And it's great to know all these things and know what options I have. And it was great to hear about the new treatments that are in the works, that'll hopefully be out in the next few years, that sound really promising. And I mean, it just sounded great. And so I had a good time, and I'll keep you updated on when I hear about my appointment with the lupus clinic. And yeah, so I guess that's it. Like I said, it was a great day, and it was nice seeing everyone and learning about this crazy disease. Anyways, I will see you guys in the next video. Bye.